how close are we to seeing a vaccine against the coronavirus?
Good evening, Ms. Singh. Experts like Anthony Fauci at the U.S. National Institutes of Allergy and Infectious Diseases have estimated that it will be 12 to 18 months until we have a vaccine against COVID-19. And when you put it into perspective, it seems like a long time, but if we were to take the average vaccine, we would often say that it takes 5 to 10 years and $1 billion to do this. So I think that we're operating under an extraordinary set of features of this epidemic that are really shocking people around the world and stirring governments and international organizations into action.
And in fact, the big focus, Dr. Kim, will also be a vaccine that is available to all. We saw those news reports about 2 weeks ago about certain countries pushing to get the vaccine faster. How will we ensure that when a vaccine comes in the 12 to 18 month timeline, given that this will be a vaccine that will be available to the poorest of the poor in India, as well as developed countries too, that it shouldn't be a vaccine only for those who can afford it?
Yes, ma'am, that's actually a critical question. Access to vaccines has been a real feature of the last decade of global health. I think on the one hand, India is going to benefit because of some actually well-placed investments with the Coalition for Epidemic Preparedness Innovations, or also called CEPI. CEPI was designed to design vaccines for outbreaks, and COVID-19 is the perfect example of an outbreak. And CEPI was ready with funding, including funding that the Indian government had committed to develop vaccines for just this contingency. And in fact, within a few weeks of the announcement of COVID-19 disease by the Chinese and the sequencing of the viruses that was published, a number of companies had contracts with CEPI, 4 of them in fact, and one of those companies has actually entered clinical trials last week, which is extraordinarily fast. And we're all hoping that Indian companies, South Korean companies, and companies around the world will be able to move vaccines forward quickly with support from national governments, regulators, and organizations like CEPI and the World Health Organization.
Absolutely, and we've got some great Indian vaccine manufacturers as well right here also working on this as part of a larger coalition. But Dr. Kim, to ask you, and of course you're speaking from South Korea, and the model being followed in South Korea has been touted across the world really in terms of rapid testing, rapid diagnosis, the number of recoveries being over 5,000, matching the number of cases are over 9,000, number of recoveries over 5,000, deaths at over 100, 128, I think, at last count. Now, look at what's happening in Europe and then in the US as well, an explosion of cases. How would you see the different country models that have unfolded so far?
So I think Korea was, it won't have thought so at the time, but the outbreak of the MERS syndrome, Middle East Respiratory Syndrome, in Korea in 2015 actually taught the government some important lessons, and among them, the importance of preparedness. So in the meanwhile, the government of Korea passed a number of laws that made it easier to deal with this outbreak. And that included some of the laws regarding privacy and the use of data, anonymized personal data, to let the population know where new cases were developed. So in my neighborhood, if a case were identified, I would get a actually very loud and annoying alarm that would say, the following case has been detected. And if you went to the website for the local jurisdiction, it would tell you exactly where that person was. It would confirm that they had been there between 10 o'clock and 10:15. And if you had been there, you should, and you develop symptoms, you should consult with a healthcare provider. So that kind of information was only possible because appropriate guarantees to confidentiality and privacy had been made, not during the epidemic, but before it. The idea that testing was going to, sorry, yes, ma'am.
No, go ahead, sir. Please finish your answer.
So the idea that South Korea followed, which is really following the WHO guideline, testing, isolation of those who are infected, tracking of those who are potentially exposed, treatment of those people who come down with the disease, and then, again, emphasis on early diagnosis. And I think the United States is starting to ramp up its testing substantially. And what you see when you start doing that is the death rate starts to fall. So in the United States, it actually started out fairly high. As you ramp up testing, you're going to be picking up cases of individuals with milder disease who are going to do better. And so the mortality rate starts to fall. So at this point, mortality rate in the United States and South Korea are actually not that different. But again, the United States did hundreds of thousands of tests to catch up.
As I speak to you, Dr. Kim, India is on day 6 of its lockdown, the world's biggest lockdown, as it were. What do you feel about the India model so far of tackling this? The good news is that the Health Ministry has just said that there's no community transmission yet, and the first 6 days of the lockdown seem to be showing a slowing down of the spread of this outbreak.
So that's actually critically important, because a country's ability to respond is actually, to some extent, also limited by what resources they have available. So whereas in Korea, they were able to largely contain it within one city and a province, in Seoul, the attack rate has actually been pretty low. In a country the size of India, though, things are magnified substantially. And migration out of the cities into the countryside as a result of the lockdown has the potential to spread disease. But as long as the ministry is on top of surveillance and can actually diagnose and isolate cases that are infected, then the ability of such a strategy to flatten the curve may be very effective, because it will allow resources to be spent in a manner that is much more rational, and will mean that people who need care hopefully will get care. So there are lots of reasons for doing this.
So in your perspective, do you think the India model, because the WHO has said really how India's response to this epidemic, to this pandemic, will really in a sense determine how global numbers as well. So you think this is the right way to go for India, lockdown in every possible way, no morning walks, etc., and testing, focus on testing as well, or do you think that comes secondary at this point?
So limiting exposure is always the first step. So social distancing, decreasing people's going to restaurants and theaters or concerts, and is actually very important. And if you look in Korea, there were no lockdowns, but there was high social compliance with the government's request to separate yourself, to wear masks, to wash your hands. I mean, the government's messaging was very clear, very decisive, and was based on data. So it's difficult, for instance, for me to comment on the Indian data, because actually I probably don't have access to exactly what the government had. But in Korea, the government was always forthcoming. The Vice Minister of Health briefed the nation every day and told people what was going on, what the government was thinking, and made new announcements. And that kind of transparency and decisiveness and decisions made on data are really the things that are going to help in the Indian case as well as they did in the South Korean case. I think also, sorry, yes, ma'am.
No, please go ahead.
No, so again, the ability to make decisions, decisive decisions made on data, you don't, if you're in government, and it's a terrible responsibility, but someone has to make a decision, and they have to make those decisions based on data, and hopefully they'll make those data known as they're making the decision, so that the reasons for the decision are clear. Someone needs to be the point person and come forward with these very clear statements about what Indians need to do to protect themselves.
Right, and in that sense, the Indian government has been very proactive in its communications, though of course India unique challenges of its own, population of 130 crores, a population also where social distancing is often seen as a luxury, accessible only by the middle class, very, very high population density. So in that sense, Dr. Kim, with your experience, the advice for a country with a population density like India's would be very different from a country than, like, say, South Korea or European countries. What do you think in a country where social distancing isn't that easy for a large majority? What's the best way to go forward?
So, Korea actually has a fairly high population density also. And, to the extent possible, the government made use of its ability to message, to tell people that of the importance to protect themselves, and in protecting themselves, they're protecting others. I mean, it's one thing to be, if we could all be 20 years old again, but the important thing to remember is that you're not alone, right? You have a family, you have mother and father, maybe a grandfather, grandmother, and children who are in the same household. And to the extent that you protect yourself, you're protecting them. So as you distance yourself from potential contact, you're really protecting the people that you live with, the people that you love, your neighbors, from harm.
Dr. Kim, again, with your perspective, why do you think the explosion that we've seen in Europe, Asia luckily has not, the epicenter moved away in a sense from China and other Asian countries to Europe, and the tragedy, the colossal human toll and the high death toll we're seeing in countries like Italy, Spain, the worries in France, and in Britain earlier there was this theory that perhaps herd immunity, as suggested by the Prime Minister who now tested corona positive himself. Where do you think the Europe model or the diagnosis system seems to have failed?
So I think that, again, preparedness is key. And clearly there was transmission in Italy. You know, they talk about the patient number 1. That person was not probably patient number 1. He may have been patient number 2,000. And so the ability of the virus to spread, the 80% of people who are relatively asymptomatic are able to spread the disease fairly effectively. And in the absence of diagnosis and the absence of suspicion of diagnosis, so in that case of that poor person in Italy, no one suspected that he had COVID-19 because he didn't have the traditional risk factors. So again, it was a high index of suspicion, it was testing, and then finally uncovering a series of deaths that was important. The same was true in the United States, in Seattle. The cluster of deaths in the nursing home was just the tip of the iceberg, because under that, there were hundreds of people who had been exposed, including nurses, and doctors, and family members, and healthcare providers, first responders. So we really, you know, as I think the lesson for India, for other countries, and the lesson we learned from Europe is the importance of testing. As they saw the problem in China and Korea evolving, countries should have, you know, been using that time to prepare, to set up the systems of surveillance, to set up adequate systems to identify cases that didn't actually have or meet the standard criteria, like exposure to someone from China or visit to Wuhan. Because I think the thing that we learned about this epidemic and that we learn in all epidemics is that we always, the epidemic is always smarter than the doctors. It always seems to find a way into countries. And, you know, just because South Korea has managed to control but not eliminate the disease doesn't mean that at any one time, a person coming from a country with local transmission can't come to Korea and cause a new outbreak. And so even though it appears under control, the need to be vigilant will remain. And India will have that same pressure in order to maintain or to control COVID-19.
Do you find, doctor, that when they say that the Asian population may have greater immunity to this, or that higher temperatures in Asia or in South Asian countries is something that's going to help? Do you find any truth at all in that?
So I think that at this point, the virus is behaving as though it is entering a brand new population, what we call a naive population, a population that's never seen this particular virus before. I mean, if you look at the sequences of the virus around the world, it hasn't undergone much mutation. It's really, you know, an outbreak. And the viruses many of the viruses that are found in the United States have an origin, you know, maybe through Europe, but in China. The viruses on the West Coast, many of them came directly from China. You know, it's not a Chinese virus. You know, SARS-CoV is a virus that's attacking everyone in the world. And, you know, together we need to find treatments that work. We have to find a vaccine that works. And when we do, you know, we'll have an answer that will allow us to get back to our normal lives, to a normal economy, to being able to interact with family and friends.
And on higher temperatures, do temperatures have any impact on the virus at all in studies you've seen, doctor?
So at this point, we don't know the answer. But I would suggest that, you know, we had seen outbreaks in Singapore, as well as in South Korea. And I think that, you know, we're increasingly getting information that the virus may be present in Africa. So, you know, like the flu virus, which tends to occur in the wintertime, there could be other reasons why, you know, for instance, the fact that as it gets warmer, people aren't normally indoors. So they're not congregating together, which means that they're not coughing on each other. And as we get outside, as the weather warms up, you know, there could be other reasons for lack of transmission. But the important thing to know is that in the southern hemisphere, the seasons are reversed. And in the tropics, flu is transmitted all year round. So, although COVID-19 is not the flu, there are some features that are similar in the way it's transmitted. It's actually more transmissible than the flu. So it actually could have a northern hemisphere, southern hemisphere, year-round distribution until we find a solution. But we don't know. There's just not enough information.
Thank you so much, Dr. Kim. Finally, as you said that we get back to normal life, what will normal life be now, given the fact that this is not a virus or an outbreak that we can say after a 3-week lockdown it goes away? It's something that we just live with now. What will the new normal be, or what is the new normal you would recommend that every citizen of Earth actually now implements as part of normal daily life?
Yeah, so that's actually a great question. And what we have now really are only models of what we could do. And you can see an ongoing experiment going on in South Korea. So the epidemic has largely been controlled, and typically now the number of new infections per day is somewhere around 100, sometimes less, sometimes more. And there are outbreaks, occasional bursts of activity found because they found a group of people who've been infected together. So what do? Do you suppress and then release over time, and then resuppress if the epidemic occurs again? And that's likely to be the only pattern that will allow some level of economic activity and other things, mindful of the risk that we have to be completely on guard when that happens. And the population needs to be ready, and they need to understand what needs to be put into place again if the strategy of release doesn't work. I think most important, the governments that have access to data are really going to have to look carefully at where the new infections are occurring, where the epidemic is spreading, and then if they're planning to do a release, it has to be timed to a part of the cycle where we actually are able to monitor the new infections. Remember that when you see a burst of new infections, you're actually looking at the infections from 2 weeks ago.
Right.
So you're not getting a real-time picture. So the government has to be very careful when it releases things. It has to know that the outbreak is under control, that suppression is working. Otherwise, we will get confused by new infections and new outbreaks, and it will be difficult for us to sort out whether something worked or didn't work. So again, I know it's difficult and to be patient, but in this situation, with the potential risk to billions of people, governments need to be careful about their decisions, because the decisions that are made in India are also going to affect other countries around the world, as you pointed out. I mean, India is 1.3 billion people, and an outbreak that's not contained in India will have definite implications globally.
Dr. Jerome Kim, Director General of the International Vaccine Institute, thank you so much for joining me from Seoul, South Korea. It was wonderful to speak to you. Thank you.